Hello, welcome to Anatomy DAHAR series. Today's topic is Movements of the Mandible. Illustrated, prepared and presented by Dr. Abdul Hamid, Abdul Rashid. Author's note. Anatomy is a subject about structures of different parts of the body, their locations in relation to one another, and their possible bodily functions. Therefore, it is the basic and foundation subject in medicine. Considering the number of structures making up different parts of the body, anatomy is essentially composed of many names and facts. The problem is how to remember them. One way is by reading the text repeatedly, another by using mnemonics, and some follow other means such as discussions, etc. Personally, I believe in the saying, a picture is worth 1,000 words. Anatomy is considered as being composed of structures that can be readily visualized, and the subject can be learned through appropriate diagrams. In fact, learning anatomy without diagrams would be like sailing through uncharted waters without a compass. Learning anatomy from simple, clear, and well-illustrated diagrams may be considered the best way to learn and remember the subject. Studying such diagrams carefully would clearly reveal the locations and relations of the structures in the body and facilitate learning and remembering. Hence, I would like to suggest and advise the readers of Anatomy DAHAR series to try and learn anatomy through the diagrams, as I have provided good enough of diagrams in each topic. Thank you. Abdul Hamid, Abdul Rashid. Movements of the temporomandibular joint. There are three sets of mandibular, that is the lower jaw movements at the temporomandibular joints. They are number 1, depression and elevation of the lower jaw to make the mouth open and close respectively. 2, protraction, that is protrusion and retraction of the lower jaw. And 3, side to side, that is grinding, chewing movements of the lower jaw. Two groups of muscles are involved in movements of the temporomandibular joint. They are main group of muscles and accessory muscles of mastication. A. Opening of the mouth. 1. Slight opening, that is less than 22 mm. Heads of the mandible rotate around the transverse horizontal axis, that is the fulcrum, in the hinge-like movement. This is the one head. Here is the axis, transverse axis, which is the fulcrum. It occurs in the lower compartment of the TM joint, between the inferior aspect of the disc and head of the mandible, that is menisco-mandibular compartment. It is done by the action of lateral pterygoid muscles and gravity. Continuation or opening of the mouth. Let's see the diagram. This is the head of the mandible. This is fossa for the head, and this is articular tubercle. Let's talk the second one, wide opening of the mouth. Rotation of the head of the mandible in slight opening of the mouth is followed by gliding of the disc and heads of the mandible forward and downwards to the articular tubercle. That means in wider opening, the head is now together with the disc glides forwards to beneath the tubercle. It is taken place in the upper, that is menisco-temporal compartment, and called translation. In this sequence of events, the mandible is depressed further by 1. Digastric muscle, 2. Mylohyoid muscles, and genohyoid muscle. They are above the hyoid bone and called suprahyoid muscles, while the infrahyoid muscles, which are below the hyoid bone, act to stabilize the hyoid bone. They are infrahyoid muscles. Fulcrum means the point on which it turns or rotates. When slight opening of the mouth, head of the mandible rotates in the inferior compartment of the TM joint. Then the head is the center or fulcrum in this movement. But in wide opening of the mouth, the articular disc and head of the mandible glide forward together. The whole mandible rotates. The head is now moving forward along the circumference to the new position in front. Originally from here, it moves now forward as the whole mandible rotates. As the whole mandible rotates, see red arch, its center, the fulcrum of the arch, also moves slowly along the sphenomandibular ligament to the new position, that is the mandibular foramen on the medial surface of the mandible. As you know, at first the fulcrum was here, but later when the whole mandible rotates, the fulcrum is no more there. Fulcrum becomes center of this arch. Then this is the place. It moves down along the sphenomandibular ligament, finally reach to the new place at the mandibular foramen on the medial surface of the mandible. C. Closing of the mouth. It is the reverse movements of the opening of the mouth, gliding backwards of the articular disc and the head in the upper TM compartment, followed by reverse rotation of the head of the mandible in the lower TM compartment. They are done by 1. Temporalis muscles, 2. masseter muscles, and 3. medial pterygoid muscles. D. Retraction, that is forward movements of the mandible. Both articular discs and heads of the mandible together glide forwards in the upper TM compartment, that is menisco-temporal compartment, but without depression or elevations of the mandible. Both masseters and all 4 lateral and medial pterygoids are involved in such movement. This is lateral pterygoid, this is medial pterygoid, and this is masseter. So all 4 muscles, all these muscles on both sides will act in this action. Number E. Retraction, that is backward movement of the mandible. That is a reversal of protraction. In this case, both articular disc and head of the mandible together glide backwards in the upper TM compartment, that is menisco-temporal compartment. In this movement, the muscles involved are number 1, middle and deep fibers of the masseter, and number 2, digastric muscles, assisted by genohyoid muscles. F. Side to side, that is chewing movements of the mandible. Let's see the diagram, superior view of the mandibles. Let's concentrate number A. You see here, this is head of the mandibles. This is right head of mandible. This is left head of mandible. Let's start. Right head of the mandible glides forwards together with its articular disc, like in protrusion. It is due to the actions of medial pterygoid, lateral pterygoid, and masseter of same side, ipsilateral side. At the same time, on the left side, that is left head of the mandible, merely rotates on its vertical axis. There is no gliding movement is there. As a result, the chin moves forwards and towards the left side. The rotating part, this part, is called working part. This is one, WP. But the opposite one, which is non-rotating part, is called non-working part, NWP. These movements occur alternately in right and left DM joints for side-to-side movements. The end, illustrated and presented by Dr. Abdul Hamid, Abdul Rashid. Now is a good time to subscribe to our Anatomy DAHAR series channel. You will be notified as soon as our next video is available to you. Anatomy DAHAR series also provides other videos related to the present topic. Enjoy and thanks for watching.